Essential micronutrients often lacking in the elderly, and how to supplement effectively. As we age, the body undergoes many physiological and metabolic changes. One of the most common issues in the elderly is the deficiency of essential micronutrients, tiny but incredibly important substances for maintaining health, flexibility, and mental clarity. Recognizing and supplementing these nutrients properly can help older adults live healthier and happier lives each day. 1. Calcium, a friend to bones and joints. What is calcium, and why is it important for the elderly? Calcium is the most abundant mineral in the human body, with about 99% stored in the bones and teeth. The remaining amount plays vital roles in muscle contraction, nerve transmission, blood clotting, and heart rhythm regulation. For older adults, calcium is crucial in maintaining bone density, helping to prevent osteoporosis and fractures, common and serious risks in aging. Why are older adults prone to calcium deficiency? There are several reasons: weakened digestion and absorption. As we age, the small intestine's ability to absorb calcium decreases, meaning even with adequate intake, absorption is not as efficient as in younger years. Vitamin D deficiency. Vitamin D helps transport calcium from the intestines into the bloodstream. Older adults tend to get less sunlight and have aging skin, leading to poor vitamin D synthesis and thus poor calcium absorption. Low calcium diet. Many elderly avoid dairy due to fear of digestive issues, or eat a limited diet, leading to insufficient calcium intake. Sedentary lifestyle. Limited movement reduces bone stimulation, causing the body to draw out calcium from bones faster. Consequences of calcium deficiency in the elderly: osteoporosis. Bones become thin and fragile, commonly leading to fractures in the hip, arm, or spine. Stooped posture, loss of height, due to weakened spine, muscle and joint pain. Fatigue, heavy legs, chronic back pain, cramps, numbness in limbs, since calcium is also involved in neuromuscular function. Increased risk of falls and prolonged bed rest leading to serious complications like pneumonia or embolism. How to supplement calcium effectively and safely? Follow the 3 principles: right source, right amount, right combination. Choose the right sources: dairy products, milk, yogurt, cheese, easy to digest and absorb, dark leafy greens, spinach, kale, broccoli, bone-in fish, stewed sardines or mackerel eaten whole, tofu, sesame seeds, and almonds are also rich in calcium. Get the right amount, not too much. Adults over 60 need about 1,000 to 1,200 milligrams of calcium/day. If dietary intake isn't enough, supplements may be used under medical guidance. Note: excessive calcium can cause kidney stones, constipation, or arterial calcification. Combine with vitamin D and exercise. Vitamin D helps absorb calcium. Get 15 to 20 minutes of morning sun daily, or take supplements if needed. Light physical activity like walking, tai chi, or gentle stretching strengthens bones naturally. Practical tips: drink a glass of milk in the morning or evening. Add leafy greens to your daily meals. Stew small fish until soft and eat them whole. Enjoy morning sun with grandchildren, a healthy and bonding activity. Conclusion: calcium is like the cement that builds your body's framework. As we age, this cement slowly depletes without us noticing, until the bones weaken, joints ache, and the back bends. The good news is, you can replenish calcium through proper diet, sunlight, and gentle exercise. With just a little attention each day, aging can be graceful and strong. 2. Vitamin D, the key to calcium absorption. What is vitamin D, and why is it the key to calcium? Vitamin D is not just a vitamin but acts as a smart transporter. It helps move calcium from the intestines into the bloodstream and directs it to the bones to strengthen their structure. Without enough vitamin D, no matter how much calcium you eat, most of it will be wasted and not absorbed. That's why vitamin D is called the key to unlock calcium absorption. Having calcium without the key is pointless. Why do older adults often lack vitamin D? Lack of sunlight exposure. Many elderly stay indoors, avoid sunlight, or have aged skin that synthesizes less vitamin D. Reduced synthesis with age. Elderly skin produces 4 times less vitamin D than young skin. Low-fat diet. Vitamin D is fat-soluble, so a diet low in healthy fats, like fish oil, olive oil, hampers absorption. Chronic conditions. Liver, kidney, or digestive diseases common in older adults can affect vitamin D metabolism. What happens when you're deficient in vitamin D? Weak bones, joint pain, and fractures, especially in the hips and wrists, muscle aches, fatigue, lethargy, weakened immunity, depressed mood, linked to increased risk of depression in older adults, lower resistance to infections, especially respiratory illnesses, cognitive decline. Some studies link low vitamin D levels with memory loss and dementia. How to supplement vitamin D effectively? Sun exposure. The simplest and most natural method. Sunbathe in the morning, 6:30 to 8 a.m., or late afternoon, after 4:30 p.m., for 15 to 20 minutes, 3 to 5 times per week. Wear light clothing to expose arms, legs, and face. Note: avoid harsh midday sun to protect skin health. Eat vitamin D-rich foods, fatty fish, salmon, sardines, mackerel, egg yolks, animal liver, fortified dairy products and cereals, sun-dried mushrooms, a natural plant source of vitamin D. Use supplements if needed. If diet and sun are insufficient, doctors may recommend vitamin D supplements, pills or drops. Recommended intake for seniors, 800 to 1000 IU/day, depending on health status and medical advice. Suggested combination. To help calcium absorb better, older adults should take calcium together with vitamin D3, often found in supplement formulas. Take after breakfast or lunch, with a meal containing healthy fat, to boost absorption. Avoid taking with strong tea, coffee, or iron supplements, as they hinder absorption. Conclusion: vitamin D is the indispensable bridge between nutrition and strong bones for the elderly. Its deficiency can be subtle, with no clear symptoms, but the long-term consequences are significant. So, be proactive, get sunlight, eat well, stay gently active, and have regular checkups for a steady, vibrant, and fulfilling old age. 3. Vitamin B12, reviving energy and memory. What is vitamin B12 and why is it important? Vitamin B12, also known as cobalamin, is a crucial micronutrient for the nervous system, blood formation, and energy maintenance, especially for the elderly. B12 plays a key role in protecting memory, preventing cognitive decline, and helping to keep the mind sharp. You can think of vitamin B12 as a battery charger for the body. Without it, you will feel tired, sluggish, unfocused, and even prone to confusion. Why are the elderly often deficient in vitamin B12? There are many reasons why older adults may lack this vitamin, such as reduced absorption. As people age, stomach acid production decreases, which is necessary to release B12 from food. Many older adults suffer from atrophic gastritis or Helicobacter pylori infections, further impairing B12 absorption. Poor diet. B12 is mainly found in animal-based foods like meat, eggs, and milk. A vegetarian or overly restrictive diet can easily lead to deficiencies. Long-term medication use. Some common medications in the elderly, such as antacids and metformin, for diabetes, can also reduce B12 absorption. Warning signs of vitamin B12 deficiency. B12 deficiency usually progresses silently and is often mistaken for normal aging symptoms. However, some telltale signs include prolonged fatigue, even after rest, memory problems, forgetfulness, and mental fog, numbness or tingling in hands and feet, fast heartbeat, shortness of breath due to anemia, mood changes, irritability or depression, swollen, inflamed tongue, loss of taste sensation. If not detected and treated early, vitamin B12 deficiency can cause irreversible nerve damage. How to effectively supplement vitamin B12 through your daily diet. Vitamin B12 is abundant in foods such as beef liver, red meat, poultry, egg yolks, milk and dairy products, cheese, yogurt, duck, salmon, tuna, sardines, fortified breakfast cereals. A good option for older adults who prefer a light breakfast. Note: vitamin B12 is not found in natural fruits and vegetables, so vegetarians may need to supplement with pills or nutritional products. Taking supplements. For those who have difficulty eating a balanced diet or absorbing nutrients, doctors may recommend B12 supplements in the form of oral tablets or regular injections. Supplements are often available as sublingual tablets, capsules, or liquid drops, which are easy to use for the elderly. Recommended dosage: 2.4 micrograms per day for older adults, may be higher in case of severe deficiency. Consult a doctor. Tips for caring for elderly relatives with B12 deficiency: have them undergo regular checkups, including blood tests to check B12 levels. Pay attention to small signs like forgetfulness, lack of speech, limited physical activity, or mental confusion. These may be early warning signs. Regularly change their meals to avoid monotony, ensuring nutritional balance. Encourage mental activities such as reading, playing brain games, or chatting with family members to stimulate the brain. Conclusion: vitamin B12 acts like a clean energy source, helping to revive memory, strength, and spirit for the elderly. Detecting and supplementing B12 in time not only improves physical health but also helps your loved ones stay sharp, live joyfully, and enjoy healthier aging each day. 4. Zinc, a micronutrient supporting immunity and taste. What is zinc and what role does it play in the body? Zinc is a trace mineral that, although present in very small amounts, plays an extremely important role in over 300 different enzymes in the body. For older adults, zinc helps boost the immune system, helping the body fight off infections, viruses, and bacteria, support wound healing, maintain taste and smell, preventing a loss of appetite, reduce inflammation, stabilize skin and hair function, support nerve activity and memory. In short, zinc is the silent guardian that protects health every day, especially in older adults with weakened immune systems and reduced taste perception. Why are older adults prone to zinc deficiency? There are several common reasons: decreased absorption with age, the intestines weaken, and zinc metabolism decreases. Monotonous diet, lack of protein or vegetables. Many older adults eat less or have overly restricted diets. Zinc loss through urine due to diuretic medication, diabetes, kidney failure, etc. Chronic conditions such as arthritis, fatty liver disease, and prolonged infections can cause the body to consume more zinc than usual. Signs of zinc deficiency in older adults. Zinc deficiency may not be immediately noticeable but can have long-lasting, subtle effects. Some easily recognizable signs include loss of appetite, bland taste, and food aversion, reduced sense of smell and taste, eating without being able to taste or smell properly, frequent colds, infections, and slow recovery from illness, slow wound healing, dry cracked skin, or rashes, hair loss, brittle nails, forgetfulness, mental decline, irritability, muscle weakness, tingling sensations in hands and feet. How to effectively supplement zinc for the elderly. Through daily food intake, foods rich in zinc should be included regularly in meals: beef, chicken, and animal liver. Seafood like oysters, clams, shrimp, and crabs, especially oysters, which are known as the king of zinc. Eggs, chicken or duck. Nuts, pumpkin seeds, sunflower seeds, cashews, soybeans, mung beans, black beans, whole grains, whole wheat bread, cheese, yogurt, help supplement zinc and other micronutrients. Tip: even if older adults eat less, dividing meals into smaller portions throughout the day and varying the dishes can help boost zinc absorption naturally. Supplement with pills if necessary. If the diet doesn't provide enough zinc, zinc supplements, either in single or multivitamin forms, combined with vitamin C, B6, B12, etc., can be used. Recommended dosage: 8 to 11 milligrams per day for older adults, depending on gender and health status. It is advisable to consult a doctor before using higher doses or long-term supplementation. Tips for caring for elderly relatives with zinc deficiency. Monitor their eating habits. If you notice they're eating less, preferring bland food, or losing interest in meals, it could be an early sign. regularly change the dishes, season food to taste, and make meals visually appealing to stimulate their appetite. Encourage light physical activities and morning sun exposure to improve metabolism and nutrient absorption. Schedule regular checkups if there are accompanying chronic conditions to ensure overall health management. Conclusion: zinc may be a small mineral, but it has a profound effect on the overall health of older adults, from the immune system to appetite, skin, and memory. Proper zinc supplementation not only prevents disease but also helps your loved ones enjoy their meals, stay healthy, and live more joyfully every day. 5. Iron, an important blood-building nutrient. What is iron and its role in the body? Iron, Fe, is an essential trace mineral that plays a central role in the production of hemoglobin, the substance that helps transport oxygen from the lungs to the organs in the body. Additionally, iron is involved in many vital functions, including red blood cell production, helps prevent anemia, energy metabolism, supports vitality and reduces fatigue, boosts memory and concentration, supports a healthy immune system. In older adults, adequate iron supplementation helps prevent anemia, chronic fatigue, and maintain stable cardiovascular health. Why are elderly people prone to iron deficiency? Iron deficiency is common among the elderly due to various reasons: reduced iron absorption due to a weakened digestive system with age, poor diet, low in red meat, green vegetables, or excessive restrictions, long-term medication, e.g., antacids, aspirin, affecting iron absorption, hidden gastrointestinal bleeding, e.g., gastric ulcers, hemorrhoids, chronic conditions like kidney disease, cancer, and chronic inflammation reduce iron utilization. Signs of iron deficiency in older adults. Iron deficiency doesn't show up dramatically and is often mistaken for the natural signs of aging. Some symptoms to watch out for: chronic fatigue, feeling weak even after light activities, palpitations, rapid heartbeat, and shortness of breath without heavy exertion, frequent dizziness, lack of concentration, and memory loss, pale skin, pale lips, and brittle nails, insomnia, restless sleep, craving unusual things, like ice, a distinctive sign of iron deficiency. If these symptoms persist, it is advisable to have the elderly person checked for hemoglobin and serum iron levels. How to effectively supplement iron. Through daily foods. Foods rich in iron should be included in the diet: red meat, beef, lean pork, animal liver, sea fish, especially sardines, salmon, and tuna, dark leafy vegetables, amaranth, spinach, and bok choy, eggs, especially egg yolks, beans, black beans, red beans, and soybeans, whole grains, iron-fortified bread. Note: animal-derived iron, heme iron, is easier to absorb than plant-based iron, non-heme iron. Tip for enhanced absorption: drinking orange juice or eating fruits rich in vitamin C, oranges, guava, pineapple, strawberries, during meals can help enhance iron absorption from plant sources. Supplementing with iron tablets if needed. Iron supplements, either alone or combined with folic acid and vitamin B12, can be taken, especially when clear signs of anemia are present. Recommended dosage for older adults usually ranges from 10 to 30 mg/day, depending on health condition. Warning: overdosing on iron supplements can cause constipation, nausea, or digestive disturbances. Do not self-prescribe high doses without a doctor's recommendation. Care tips for older adults with iron deficiency: divide meals into smaller portions and ensure a variety of proteins, vegetables, and fruits. Avoid drinking strong tea or coffee right after meals, as they can hinder iron absorption. Encourage light physical activity and morning sun exposure to improve circulation. Regularly monitor blood levels, especially if there are chronic conditions or ongoing medication use. Conclusion: iron is not only a crucial mineral for younger people but is also extremely important for older adults, who are more susceptible to anemia, low energy, and weakened immunity. Proper iron supplementation helps keep the body healthy, the mind sharp, and reduces the risk of overall fatigue. 6. Magnesium, balancing nerves and heartbeat. What is magnesium and why is it important? Magnesium is an essential mineral involved in more than 300 chemical reactions in the body. In older adults, magnesium is especially vital because it stabilizes the nervous system, reducing stress and anxiety, maintains a steady heartbeat, helping prevent cardiovascular issues, improves sleep quality, aiding in deeper, more restful sleep, relaxes muscles, helping prevent nighttime cramps, supports blood sugar and blood pressure regulation. Magnesium acts as the body's silent regulator, maintaining balance and calming the system from within. Why are elderly people often magnesium deficient? Magnesium deficiency often goes unnoticed because its symptoms are not obvious, but it is quite common among older adults due to an imbalanced diet, low in leafy greens and whole grains, reduced absorption in the small intestine due to aging or digestive issues, long-term use of diuretics, antacids, and cardiovascular medications that cause magnesium loss through urine. Chronic stress and long-term sleep deprivation increase magnesium depletion. Signs of magnesium deficiency in older adults. Here are common signs that the body may be lacking magnesium: insomnia, tossing and turning, waking up in the middle of the night, irritability, anxiety or nervousness for no apparent reason, irregular heartbeat, sometimes feeling palpitations, nighttime muscle cramps, muscle spasms or shaking hands and feet, headaches, dizziness, or increased fatigue when the weather changes, high blood pressure or difficulty controlling blood pressure even after treatment. If these symptoms frequently appear, it is recommended that elderly individuals have their magnesium levels checked and properly supplemented. Effective ways to supplement magnesium for older adults. Through daily diet, magnesium is abundant in the following natural foods: dark leafy greens, spinach, amaranth, kale, nuts and seeds, almonds, pumpkin seeds, cashews, chia seeds, whole grains, oats, brown rice, barley, legumes, soybeans, black beans, green beans, avocados, bananas, and dark chocolate. Tip: incorporating nuts into snacks or adding them to yogurt or porridge can make magnesium intake easier to digest and effectively absorbed. Through supplements, if needed, older adults can supplement magnesium through tablets or effervescent magnesium lactate, citrate, or bisglycinate. Recommended dosage: around 300 to 400 mg/day. Depending on the individual's health status and level of deficiency. Note: excessive magnesium supplementation can cause diarrhea or digestive issues. Always consult with a doctor before taking long-term supplements. Tips to help older adults absorb magnesium better: encourage slow eating and thorough chewing to enhance digestion and mineral absorption. Limit coffee, alcohol, and sodas as they deplete magnesium. Engage in relaxation, meditation, and light walking in the afternoons to reduce stress, a major factor in magnesium depletion. Prioritize a light evening meal with vegetables and seeds, which promote better sleep and stabilize the nervous system. Conclusion: magnesium is the silent friend of the nervous and cardiovascular systems. As people age, their bodies need additional magnesium to maintain internal balance and tranquility. Don't let magnesium deficiency disrupt sleep, cause palpitations, or lead to mental confusion. Make it a priority in senior health care. Small tips for children and grandchildren. Pay attention to the daily meals of parents and grandparents. Choose fresh, simple foods that are easy to chew and digest. Walk together in the morning sun and enjoy gentle strolls to keep the body flexible. Conclusion: micronutrient deficiency is not a trivial matter for older adults. Symptoms like fatigue, insomnia, forgetfulness, and pain could stem from micronutrient deficiencies that we may not be aware of. Start with small changes in diet combined with a healthy lifestyle. This is the best gift you can give to your loved ones.